trajectory and how that led you to reach out and read.
Sure. Well, thank you, Dr. Hambidge, for having me, and hello, everyone. I am a pediatrician by training, trained way back when in the late 80s, early 90s, and took a sort of circuitous path to public health, where I now serve as the Chief Medical Officer and Executive Director of the state's Public Health Department. So I've always had kind of a penchant for kids and families and folks who are underserved, whether they're uninsured or publicly insured or whatever the definition is. And remember, you know, back in those days of the late 80s, early 90s, being approached with this idea in a program out of Boston, which was to say, let's give kids who come in for preventive well child checks and well baby checks a new book at every visit. One is a way to promote literacy as part of overall good health, and two, to be able to do something, you know, that helps enrich a pediatric practice and enrich the lives of the families by giving out those books, by having volunteer readers model good reading in the waiting room, and then also by having the anticipatory guidance that we as pediatricians give our families on how to read to your children or how to get them to appreciate books from 6 months to 6 years. And we got that grant along with one of your colleagues, Dr. Steve Vogler at Denver Health. And so between our clinic, the Rocky Mountain Youth Clinic, and Denver Health, I think it was the East Side Neighborhood Health Center.
Or West Side, I think was the first one.
Yeah, West Side. They were the first clinics in the state more than 25 years ago to get started, and it's now grown into this whole fantastic statewide initiative. So would love to hear about your path and how you got involved and how you ascended to this chairmanship.
Well, like you, I was just a couple of years behind you. I was a pediatric resident in the mid-90s, 94 to 97, and I had my continuity clinic at the West Side Clinic. And as you pointed out, there were these early experiments going on in Colorado, probably at Rocky Mountain Youth, certainly at West Side, and also, interestingly, in the Denver Health Medical Library. At the time, we recently found a poster from an initiative on early literacy that was going on in 1991 in the medical library there, which was kind of cool. But so even though the Reach Out and Read program per se wasn't going, in retrospect, all the pre-work was going on, and so I was exposed to this concept as a resident, and I just assumed that was part of pediatric practice, and it resonated with me, I think probably for the same reasons it resonates with you, but also I come from a family of physicians and teachers, and so education and literacy were sort of part of my upbringing, and knowing the impact that early literacy in particular can have on young children. And I think especially as a resident and then as a young faculty member, once you and Steve had gotten this early grant and started to build the program up, and seeing the impact that not just giving a book, although giving the book was pretty powerful, but talking with a family, often the mom, but many times the mom and the dad, about the importance of early reading, and then also watching their reaction to the book. I felt like I could learn so much about that child's development from watching how the family took the book and then interacted with the child, and you could actually tell if a parent were illiterate themselves, or if they had never, if it was an awkward moment, you knew this was going to be a longer conversation, and that you better be looking out for some other things in that kid. So I always felt like it was just part of the developmental screening process as well. And then to watch what's happened over the last 20 years. So I've been at Denver Health my whole career, most recently as their chief ambulatory officer and running all of the clinics. But I feel like my roots date back to those years at the West Side Pediatric Clinic. So, and then just I've been affiliated with Reach Out and Read Colorado for a number of years, at least 5 on the board, and then for the last 6 months as board chair. So this has been, I feel like it's coming full circle.
That's great.
Yeah.
Yeah, full circle, you talk about the influence of your family, and your dad actually was one of my mentors.
Oh,
I
small
don't know
world.
if you remember that or
Yeah,
not, but
yeah.
he was one of my mentors when I was in my pediatric residency training, so totally get the connection between education and pediatric development. You know, I think when we first started the program, it was interesting because it starts at 6 months of age, and people were like, why are you giving a 6-month-old a book? And, you know, it's those little block books, and often the baby's taking the book and chewing on it and playing with it and doing anything and everything but reading.
And you're telling them, Mom, it's fine, it's okay.
Right, because it's a familiarity and
Yeah.
it's a developmental stage, as you know. And so it's nice to be able to see all those developmental steps at 6 months and 9 months and 12 months, and even go through that with the parents, because the parents' first instinct is, oh, no, get that out of your mouth, or don't wreck the book, or whatever. And it's like, no, let them take the book, and, you know, we don't want them to eat the book, but they can certainly, you know, chew on the book and get familiar with it, because then their eyes do light up at those older age visits when they're 3, 4, 5, 6. When you're bringing them the book, it's one of the first questions that they end up asking is, you know, where's my book? So.
Yeah, and the concept of the child that you've seen through their entire, you know, early childhood life, getting to age 5 and having 10 books that have come from the program is pretty cool. And in worst case scenario, they may be the only books that child has, although more often they're hopefully at least supplementing some other books.
Yeah.
Yeah.
Well, it gives us the basis, as I'm sure you've done, to really create a whole program around it. We have red wagons in each of the clinics that are filled with books that are gently used books, or maybe new books that people can donate. And many of our families bring books back or donate books for other families so that kids can go through the red wagon and pick out a treat. I can't remember the last time a patient has asked me for a lollipop, which used to happen a lot in the old days. Now they ask for a book, which is great. And again, it just kind of creates this culture of, you know, we get to address some other things, not just give kids shots, not just, you know, inflict pain or examination or whatever. We get to really do some other things, which again, as a pediatrician, is very rewarding.
Yeah, and the reading corners in the clinics are another, you know, part of the program, and watching families read in there and volunteers read in there. One of my favorite memories is the reading corner at Westside a number of years ago, having 4 of Colorado's first ladies all reading books in the reading corner at the same time. It was quite a moment.
Oh, that's great.
Yeah, covering many years.
I don't think we have any famous readers. But, what's your favorite book?
You know, I've always been a big fan of Where the Wild Things Are. I think that encompasses that fear of the unknown and the satisfaction that comes with sailing off into the unknown and then coming back into your room. So,
Nice.
yeah. How about your favorite book, Larry?
I'm kind of a Curious George fan, you know, so, and I like Clifford. You know, I think any sort of animal depiction of kind of curiosity, a little clumsiness, but well intent, I think is kind of cool for someone like me, as well as for kids, to kind of say, hey, it's okay, you know, we're all a bit curious or all a bit clumsy, and as long as we're well intended, good things happen.
Yeah, I love those books too.
Yeah.
So let me, since you're the chief medical officer for Colorado, in addition to having been so involved with Reach Out and Read, how do you look at Reach Out and Read Colorado, which in essence is a one-on-one intervention, right? It's a pediatrician or a family physician or a nurse practitioner or a PA, you know, talking about reading and giving a book to a family in a one-on-one situation, but then help me think about how that impacts population health.
Yeah. Well, I think that's the key, is I think it's a population health intervention, but it's directed toward what we now call a social determinant of health, that we don't always have to address something that's in kind of that medical lane, but that we can impact kids' health and people's health by looking at the social determinants. You know, is it their education? Is it what kind of job they have? Is it their living circumstance or transportation? And so this fits very well with education. If we as pediatricians and family practitioners and folks who are involved in the health of children statewide invest our time in giving out books, promoting literacy, then these kids are better prepared for school, they can do better in school, and we have really a fantastic opportunity to impact their health at a population level, even though it is one pediatrician or one practitioner at a time.
I love that. Yes, very well said. So how have you seen the sort of landscape change for Reach Out and Read Colorado over the 20 years? I mean, you sort of talked about how it started off so small, and you know, just talk about how you're, if you're involved with it now at all, and how you see it across the state.
Yeah, so I mean, I still see patients on Wednesday afternoons, actually right after this, and still participate in Reach Out and Read. You know, I think how I've seen it evolve is, again, just a greater appreciation and the numbers, as you've said. I mean, we have so many more people involved, so many more books, you know, so much more kind of enrichment going on. When we first started, we were sort of looked at like we were a little bit outside of the box. And, you know, I didn't think we were really that far outside, but, you know, then maybe another practice or two or three started to join in. And now, I mean, as you know, I mean, it's a huge statewide effort and even a national effort, which I think has become core to pediatric practice.
Yeah, I agree, and that's been one of the more gratifying things to be a part of. I guess in my role on the board is watching that statewide sort of influence, and the fact that it's now in almost every county in the state, and potentially could even be looking to expand to help, you know, beyond the boundaries of Colorado into some other nearby states that don't have you know, don't have as many resources or as much as robust a program. So
yeah. And I think it's even more important and relevant today, given the advance of technology and kind of the shift away from, you know, books themselves, unless they're e-books or it's something that you're playing with on your phone or your computer. You know, to be able to start at an early age with an appreciation for a book, regardless of, you know, the medium, I think is really important.
Yeah, and that's an excellent point, especially maybe emphasizing with young parents the importance of some non-screen time with their children, and for the child to have a non-screen option.
Yeah.
Although I agree with you, we have to be bilingual in some cases, but in terms of the actual program being able to give, if there's something about a physical book and the holding of that physical book between the parent and the child that just feels different.
Yeah, I think you mentioned bilingual, and I think this is also a nice opportunity for someone like me who is not bilingual to be able to make more of a cultural connection by being able to give a family and a patient a Spanish language book if that's the child's primary language that's spoken, because now we can connect better than, you know, because of my inability to speak Spanish, rather than counting or asking how are you. So
do you have any other Reach Out and Read anecdotes you'd like to share?
Well, I mean, I think, again, there's a lot. I mean, generally around, again, kids at very young ages chewing on the books, which is okay. Kids coming in and literally, you know, wanting to come to the office or the clinic because they know they're going to get a book or hope that they get a book. And in fact, kids even beyond 6 years of age who are coming in, you know, even as teenagers, still asking for a book, where we then go to the Red Wagon because, you know, we don't have the formal program applying to the older ages. But hey, maybe it's something that can be considered in future iterations of the program.
Yeah.
But again, I think it's just that demand and what happens with those books in practice is just great.
Yeah, and I think for me, some of I can picture specific parents who, a smaller number, but who would not realize that, that not only could you, but you should be reading to your child at a young age. And the parents would say, I thought you weren't supposed to read until they were in school. I mean, which was clearly how they had been raised.
Yeah.
And I don't see that as much anymore. I don't know if it feels like there's been progress made in that message of the importance of early literacy.
Yeah.
And maybe Reach Out and Read can claim a small, a small amount of credit for that. So, or more than a small amount, a large amount. There you go.
Yeah, exactly. Exactly.
Great. Anything else you'd like to share with our audience?
No,
We've covered quite a bit of ground.
Hopefully, I mean, most of the audience are people who participate in the program, and a big shout out to everybody who does, because again, I think that's how we make a difference at the population level, is by getting as many people participating as possible. And for those of whom this may be new, there's so many ways that you can help, and that's the greatest part about this program, is you don't have to be a pediatrician to participate. You can be somebody who's got some extra books lying around and you're wondering what to do with them. Come donate them. You might have a little extra money lying around. Come donate the money. You might want to read and might enjoy reading to kids, and maybe like me now as an empty nester, I want to sort of have the opportunity to come and read to kids who are young and who are impressionable. Yeah, so there's an opportunity, I think, to participate at that level too. So just so many great opportunities to participate in this program. There really are no excuses that should keep anyone from participating, because there's so many different ways to participate.
Well said, and thank you for your involvement from prior to day one, even, of Reach Out and Read Colorado. You've been instrumental.
My pleasure.
Yeah.
Keep going.